చెక్ చేసుకుంటారా మీరు? Good afternoon, everybody. So today's topic will be national health priorities and policies. In 2015, Government of India became signatory to UN Declaration on Sustainable Development. We will see what is sustainable development and all those things in due course of the lecture. In 2017, it brought out National Health Policy document, which was duly approved by the Indian Parliament. This policy document is intending to translate whatever decisions that have been taken at the UN conference, 2015 conference, with respect to sustainable development. In sustainable development as such has got nearly 14 goals. Amongst them, only one goal is health related, that is goal 3. So, how to translate it into action and reality? So, Niti Aayog has deliberated quite a bit and then has come out with this policy, National Health Policy, nitty-gritty of the policy. So, that is what is going to be the subject matter of today's class. In this policy document, it reiterated its commitment to sustainable development. It said that SDGs are of pivotal importance. That resolution, the very resolution adopted by the Parliament said that SDG, they have committed themselves to sustainable development goals. In an article published in Journal of International Institute of Global Health, this Dr. Satish Kumar is a UN employee. He has made these observations. So, what is sustainable development? First of all, clear definition of sustainable development, which all of you should remember at least for the next 10 or 15 years. So, sustainable development is development that meets the needs of the present without compromising the ability of future generations. Yes, we require power, but we derive power sources and spend power. When I say power, I mean electrical power. We will take care of the future needs of the future generations also. That is, we are not going to burn a lot of fossil fuels, may it be gas or may it be coal. And as far as possible, we will try to use renewable sources of energy. Solar light, solar electricity, or electricity from biogas, or electricity from wind. So this kind of alternative strategy, to whatever extent, I think so many other new development also may come, using hydrogen cars. So without compromising the ability of the future to meet their own needs. So, sustainable development goals end poverty in all its forms everywhere. Poverty has got different forms. Poverty is relative. Poverty doesn't mean just it is hunger and people dying with hunger, or But it has got several manifestations, poverty. For instance, inability to meet an emergency health situation such as, say, the COVID-19 issues. So even that also is a kind of a poverty, but it comes under the realm of relative poverty. So end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. Again, please note, sustainable agriculture and sustainable power are altogether different. So sustainable agriculture is, say, while performing the agriculture, you are taking out certain nitrogen, carbon, hydrogen, and oxygen from the soil in the form of proteins, in the form of carbohydrates. So you replace that. Don't exploit the soil mercilessly. Even soil needs to be tended carefully with due tenderness. Then only Mother Earth yields crops. So that is sustainable agriculture, wherein you will put back something. You are taking something from the agriculture, the land, and then you are putting back something into the land. And similarly, so ensure healthy lives and promote well-being for all at all ages. This is the third goal about which we will be talking in detail. Remaining four other goals I will rush through because this class is about national health policy priorities and it is not about sustainable development. So ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Achieve gender equality and empower all women and girls. Ensure availability of sustainable management of water and sanitation for all. Ensure access to affordable, reliable, sustainable, and modern energy for all. Promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. Build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. Reduce inequality within and among countries, make cities and human settlements inclusive, safe, resilient, and sustainable. Ensure sustainable consumption and production patterns. Take urgent action to combat climate change and its impacts. Conserve and sustainably use the oceans, seas, and marine resources for sustainable development. Protect, restore, and promote sustainable use of terrestrial ecosystems. Sustainably manage forests. Combat desertification. And halt and reverse land degradation. And halt biodiversity loss. Promote peaceful and inclusive societies for sustainable development. Provide access to justice for all and builds effective, accountable, and inclusive institutions at all levels. And strengthen the means of implementation and revitalize the global partnership for sustainable development. So these are the sustainable development goals, 17 goals. Out of that, we are going to, as doctors, we are required to know about goal 3. Now let us have a close look at goal 3. So extra health sectorals that may contribute to SDG 3. That is SDG, Sustainable Development Goal 3. That is, these inputs will not be directly into the health, but outside the sphere of health sector. They are air pollution, better solid waste management, and then improving the water quality, and then improving occupational safety. Occupational safety is different from occupational health. And then road safety and accident prevention, better housing, and then vector control and reduction of violence and urban stress. These are the areas which do not directly come under the purview of doctors, but these are the areas where if you put the inputs into these areas, that's when I say inputs, I mean economic inputs only. When you put in inputs into these areas, when you give reasonably fair amount of inputs into these areas, definitely health condition of the people also will improve. So that's why very quickly, this is one thing which you should always remember. Extra health sectorals that may contribute to health. SDG 3 is all right. In that context, we are talking in a context, so that is why we have put SDG 3. But what are they? Once again, this is a very important slide. That is why I am repeating. One is air pollution. Second is better solid waste management. Third is water quality, improving the water quality, occupational safety, and road safety and accident prevention, better housing, vector control, and reduction of violence and urban stress. So, the national health priorities of Government of India. So, keeping all these guidelines and especially Goal 3 of Sustainable Development Goals, so Government of India has fixed certain health priorities. Which are the priority areas? There can be so many things. In health, you can do so many things. But what are the priority areas wherein we have to work? So, universal health coverage, that is achievement through progressively better action. When you say universal health coverage, what I mean, what government means is public health system should participate in providing both medical and health care to every individual. A health care which is cost effective and affordable, and which will reduce out of pocket expenses of the individuals. So that kind of a universal health coverage has to be given. So strength in both in urban and rural areas, irrespective of gender, caste, religion, etc. All these are there. All these are the gradients which are effective. If you go and look very closely into social determinants of health, you have seen how difficult the life was for migrants during this COVID-19 pandemic. So that kind of a situation wouldn't have arisen if we had good structure to implement universal health care. So reducing WOOP expenditure. WOOP means out of the pocket expenditure. Gradually reinforcing trust in public health and medical care institutions. This is very important. And then align goals of private healthcare sector with national health policy. So taking private sector also along with us. Increase public expenditure on health, especially in central budget, to 2.5% of the GDP. At present, it is 1.5%. This year, because of COVID-19 pandemic, so much of money was spent. In spite of all this, expenditure on GDP this year also is 1.5%. This has been the situation since last 40 years or 50 years. Anyway, as far as I know, only during first 5-year plan, that is tenure of Rajkumari Amrit Kaur, Health Minister. She was a very, very dynamic and philanthropic person. So only during that period, central budget, 5% of the GDP was allocated to health. And afterwards, consistently we were maintaining only 1.3%, 1.4%, 1.2%, sometimes even 1.1% also. So increase expenditure on health to 8% of the state share in GDP. So state budget, because state, according to our constitution, health is basically a state subject. put in concurrent list. That is, center also has got a responsibility, but basically it is a state subject. So the state government should spend at least 8% of GDP and state's GDP on medical and health care. And then decreasing proportion of households who are indulging in catastrophic health expenditure by 20%. So catastrophic health expenditure, classical example is this death due to COVID-19 and that pneumonia and multi-organ dysfunction which have been there because of COVID-19. That is one example. But even otherwise, even if COVID-19 was not there also, because there are so many conditions wherein people had to spend accidents. So there is nobody to take care of their medical expenses. So they sell this land or house or some ornaments and try to do something to save the life of the person. So that is how the catastrophic health expenditure. That kind of an health expenditure is called as, because the person ultimately may get all right, but the family will never recover from the financial loss it has incurred. So that's government aims to decrease this proportion of households who are indulging in catastrophic health expenditure by 20%. To create an electronic database of health information at the district level. Now there is some information, but it is not an electronic database. At the state level, it is available at state level, and even that also is integrated disease surveillance project. Only morbidity information is available, but here all the health information they want to put it in a electronic database. We will see if they can do it. Strengthen the surveillance system and establish individual disease registries by 2020. That is one hypertensive registry, one diabetic registry, one cancer registry at the district level, so that we will be able to track the patients in a comprehensive manner. Probably they may choose to put up a thalassemia register also. But because of this COVID-19 pandemic, we have not taken, at least I am not aware of any action taken at the district level. So establish federated integrated health information architecture and national health information network by 2025. This is a very big word. Federated integrated health information architecture. In fact, health information architecture is such that it may have to differ from state to state. For instance, some states are having endemic disease. Then their health infrastructure, information infrastructure has to be different. But at the same time, the health information infrastructure of that particular state should synchronize with the information architecture of other states also. So government wants to do it. Now then government has identified 7 priority areas where action has to be taken immediately. What are those 7 areas? One is Swachh Bharat Abhiyan. This you know. All of you know it. That is cleaning up the streets, cleaning up and then cleaning up river Ganges, and then constructing lots of sanitary latrines and creating facilities for safe disposal of solid waste as well as liquid waste, that is sewage, and then improving the water supply systems, that is cleansing the water supply systems so that the raw water available for drinking is of high quality, high bacteriological quality. So this is part and parcel of Swachh Bharat Abhiyan. It is not just sweeping the roads and posing for photographs. There are so many components to Swachh Bharat Abhiyan. So constructing toilets in the village areas so that open field defecation is totally eliminated. So and balanced healthy diet and regular exercises. This is something which will be preached to all of us. What government does, what concrete plans it has got, we do not know. And then addressing tobacco, alcohol and substance abuse, again, lot of preaching. Say, for instance, even to play, place reasonable restriction on the sales of tobacco and alcohol, we are unable to do it. In fact, after COVID-19, the first emergency, economic emergency, which the government addressed is opening the alcohol shops. And then Yatri Suraksha, that is improving the safety of road transport as well as train transport and aeroplane transport. And then Nirbhaya Nari, action against gender violence. You know how nicely this is taking place. There is Hathras and there is so many other places. I don't want to go into those things because they are basically of political nature. But this very dismal situation is becoming dirtier and murkier day by day. This Nirbhaya Nari, probably it may not materialize so soon. And then reduced stress and improved safety in the workplace, and then reducing indoor and outdoor air pollution. So national health priorities of Government of India, specific quantified objectives. So they have, any health policy should have specific quantified objectives. So what are the quantified objectives which government has set itself? So increase life expectancy at birth from present 64.5 years to 70 years by eliminating infant mortality, by reducing maternal mortality, and by inputs into adolescent health, especially maternal and afterwards by inputs into maternal and child health. And then a good strengthening the vaccination program still further. So there are so many areas, and then introducing a comprehensive and oiled NCD program, that is non-communicable disease control program. All these things can bring down the mortality and improve the life expectancy. Here I may share one thing with you. Say, when I was a medical student, say nearly 40 or 50 years ago, say mortality, life expectancy at birth amongst Indians was 48. Now, in this 4 decades, it has risen to 64. So, as such, it is a very good achievement. But we want to improve it still further by 2030. We want to make it to 70 years. That is another 5 years of increment in life expectancy. And reduction of total fertility rate from present day 2.36 to 2.1. Probably in previous classes also I have explained to you what it means. That is, wife and husband, they are two, and at the end of their reproductive life, they should leave behind two persons. This 0.1 is because some child wastage may take place. So if you maintain this, then population will be reasonably stable, and probably the population doubling time will be around 70 years, if I remember correctly. Otherwise, now at present it is 29 years or 30 years. So we will double ourselves, 2.6 billion in another 30 years. So establish regular tracking of disability adjusted life years so that impact of NCDs at least can be quantified. Now we do not know anything about NCDs. So now the government wants to establish a database with which we will be able to work out disability adjusted life years, DALYs, say due to stroke, due to myocardial infarction, due to injuries to the skeletal system, due to cancer. What are the disability, how much of disability is taking place? So, because of the disability, how many working days are being lost? So, disability, otherwise, how much healthy life is left out to a human being, because minus this disability years or days. So working out DALIs, this is a complex statistical procedure, but the government wants to do something about it, and they want to monitor the condition of NCD, if not attack them immediately. To reduce under 5 mortality from present day 100 deaths per 1000 living children to 30 deaths per 1000 living children, and reduce infant mortality from 46 deaths per 1000 live births to 28 infants per 1000 live births. So 46 నుంచి 28 by 2030 they want to bring it down. I think in Telangana state is already 31 or something like that. 36 I think. So national health priorities, again objectives: reduce neonatal mortality rate from present 31 neonatal deaths per 1000 live births to 16 neonatal deaths per 1000 live births. I have, while covering maternal and child health, I have told about a plethora of programs integrated by management of neonatal and childhood illnesses, and then RMNCHA, and then home-based neonatal care program, which will be in which ASHA will be the key player, and then Janani Suraksha Yojana. So through all these interventions, and then proper antenatal care, and then screening for congenital diseases, at birth as well as the school entry and during adolescent period. So all these, so many plethora of programs are there by which they want to bring down the neonatal death and bring down the infant death and under 5 death. All these are possible. Under 5 deaths can be well controlled if you take care of the diarrheal diseases that occur, and again pneumonias, and then improve vaccination, that is especially measles vaccination. Okay, so these are, so to achieve single digit stillbirth rate, say one of the important causes of anemia, stillbirth, is anemia and maternal undernutrition. So if you improve it, probably stillbirth rate, at present I think it is 33 or 34, and now 20 it can be brought down to 23. Government wants to do it. So reduce, it is very difficult to reduce stillbirths. To reduce maternal mortality ratio present at 246 per 1 lakh live births to 100 maternal deaths per 1 lakh. These are the things time and again you will be asked in the examination. So these figures should be on your fingertips, especially with the Viva examination. Achieve a target of 90-90-90 with respect to HIV/AIDS. I think the faculty member who has taught you about HIV/AIDS control would have taught you what is this 90-90-90. That is detection of 90% of HIV infected individuals, and then testing and treating 90% of individuals with ART, and then another 90 is ensuring survival of 90% of individuals after 15 years. That is doing repeated things and then putting them on ART, different kind of antiretrovirals if they have developed. So much of the thing is there for management of ART, and then prompt treatment of opportunistic infections if they occur, and then careful monitoring of the patient for CD4 T lymphocyte count. All these things, they come under this 90-90-90 initiative. So elimination of leprosy, Kala-Azar and lymphatic filariasis by 2018. Probably lymphatic filariasis is there in our country, at least in 40 districts. I think 71 districts. And leprosy is still a problem, and from rural leprosy, now the problem has become an urban leprosy and migrant leprosy. And Kala-Azar definitely is confined to few districts in southern Bihar. and central Bihar. So probably we may be able to see the last of Kalas are in this, but it is very difficult as far as Kalas, this leprosy is concerned, and lymphatic filariasis. So tuberculosis case detection rate has to be increased and maintained at 90%. At present, I think it is at 83%. So it has to be increased, and just like HIV/AIDS, you should be able to detect 90% of the cases and achieve a cure rate of more than 85%. So if you detect 90% of the cases, and amongst them, if you achieve a cure rate of more than 85%, then what you are doing, almost all year by year, you are cutting down the transmission potential of tuberculosis by SLS within the community. So that is what you are able to do. So slowly tuberculosis gets eliminated. And in fact, we want to eliminate tuberculosis by 2050. I do not know how far we will succeed. But this is the only way. Identify 90% of the TB patients and then cure them. But the biggest problem is MDR tuberculosis. To achieve to reduce prevalence of blindness to 0.25 per thousand persons by year 2025, and to reduce premature mortality due to heart disease, cancer, diabetes by 25%. And certain other goals also, sustainable development, I have told you, it encompasses so many things. So relative reduction in prevalence of tobacco use by 30%, reduction in prevalence of stunting amongst under 5 children by 40%, and access to safe water and sanitation to all by 2020, and the reduction of occupational injuries by 40%. Example, in agriculture, present level of occupational injuries is 334 per 1 lakh population. National and state level tracking of selected health behavior. To increase expenditure on health to 2.5% of GDP in central budget and 8% of GDP in state budget. Already I have told all these things. Decrease in households indulging in catastrophic health expenditure by 25%. Increasing utilization of government hospitals and primary health centers by 50%. All the above, especially the decrease in the household indulging in catastrophic health expenditure can be improved only by improving the condition of the government hospitals. Ensuring that at least 90% of the deliveries conducted in the country are institutional deliveries. At present, I think it is around 71%. And in Telangana state, at least it is claimed that nearly 94 or 95% of the deliveries are institutional deliveries. So improving antenatal coverage to 90% of all pregnancies, and then full immunization of infants by 90% of newborns. Now at present it is standing at 74% or 77%. And 80% of the households with hypertension and diabetes should be able to maintain control. So organization of public health care delivery in primary care from selective care to assured comprehensive care with linkages to referral hospitals. In secondary and tertiary care, from an input oriented to an output based strategic purchasing. In public hospitals, from user fees and cost recovery to assured free drugs, diagnostics and emergency services. In infrastructure and human resource development, from normative approach to targeted approach to reach under serviced areas. In urban health, from token interventions to on-scale assured interventions. To organize primary health care delivery and referral support for the urban poor, collaboration with other sectors to address wider determinants of urban health is advocated. Prevention of early childhood delays, and then adolescent and sexual education, behavior change communication with respect to tobacco and alcohol use, screening, counseling and primary prevention of common communicable and non-communicable diseases, enhancing the quality of existing health packages, and then yoga at school and workplace. So these are the things, these are the national health priorities. So I have covered this. This may appear as a full essay question to you. Sustainable Development Goals and National Health Priorities. You are a regular batch, so the examiners may like to test you. So in such an eventuality, they will ask this question. Why?